For me, Ubuntu is all about interconnectedness. It's about realising that you're part of a bigger picture.
Khayelitsha means new home, and back in the late 80s, during the apartheid movement, the government sectioned off an area about 20 minutes out of Cape Town that they called Khayelitsha, and they put all the blacks there.
I remember getting off the aeroplane in Cape Town, and you drive down the Cape Flats, this main highway on the road to Cape Town, and you look out to your left, you look out to your right, and as far as the eye can see is just a sea of shanties. I mean, these shanties are home to over 1 million people living in the most atrocious conditions. Little kids everywhere. I mean, it's such a young population in Khayelitsha. They're born into a life of poverty and crime where, for the most part, getting a meal a day is a struggle. It's a hard life, and it's one with a lot of challenges, made worse by the burden of healthcare in the community. The prevalence of disease there is just incredible. I mean, HIV, tuberculosis, gastrointestinal infections is just rampant in the community, and it's a real problem. Simple things that we recover from quickly here at home kills these young children. It's a sad situation when you see kids struggling with these treatable conditions.
Khayelitsha has 10 medical clinics. So if you do the maths, it's about 100,000 people per medical clinic. Millions of people live with HIV in Africa. HIV is not a curable disease. Millions of people live with tuberculosis in Africa. Tuberculosis is curable. Both of these diseases require very, very powerful and strong medications in order to, in the case of HIV, allow people to live a better life, and in the case of tuberculosis, to eventually rid them of their disease. These medications are so powerful that if taken on an empty stomach, they cause nausea, vomiting, and an extreme hunger.
The fact that these kids especially are not getting the adequate diet to even take these medications is something that we found very important and something that we thought we could try and help.
Hundreds of patients every day go to the clinic to collect their medication for tuberculosis and HIV. What we plan to do at Ubuntu Through Health is to provide them with a nutritional meal to supplement their medication. When patients come into the clinic, they will collect their medication and be offered a meal, an EPAP meal. This meal costs $1.50 per patient per week. Now, the benefits of this meal are more than just a stomach filler. What it does is it provides the patient with an incentive to come and take their medication, an incentive to come and complete their treatment, and ultimately an incentive to come and be cured from tuberculosis. EPAP is a porridge-like meal that we have sourced from Johannesburg. It has been made by chemists who have designed this meal in order to provide patients with tuberculosis and HIV with all the nutrition that they need in order to have a strong immune system and be able to fight these diseases. We've been able to pick a clinic called the Khayelitsha Clinic and set up a 6-month program that is going to see 150 patients fed every day with this EPAP meal.
The unique thing about this program is that it's a simple idea. We're trying to provide a nutritional supplement to patients so that they can keep their medications down and that they can increase their compliance to take their medication.
There's a definite stigma which surrounds a lot of charity work where people want to give money, they have money to give and they want to help, but they don't really know exactly where that money's going. What we've done with the Ubuntu Through Health Nutritional Support Initiative is effectively provide a product where people can give money and know exactly where that money's going. For $1.50, you will support one patient for 1 week. They'll receive a meal every day when they come to collect their medication. For $6,000, you will be supporting up to 150 patients at a clinic. We follow those 150 patients every day with the assistance of NGOs over in Africa. And at the end of a 6-month period, we can look back and see, did patients collect their medication? Did patients eat their EPAP? And are patients cured of their disease?
You see the suffering in Africa and you wonder, what's the point? I mean, money's been thrown at that situation for years. How can I make a difference? And I guess our project, it's not about trying to solve the whole HIV pandemic, tuberculosis problem. It's about trying to change it at the individual level. There's kids over there, they have names, they have faces. They want to be doctors, they want to be lawyers, they want to be teachers. And they deserve to reach that potential and be who they want to be. So if at the end of the day you can just help one of those kids reach their potential, remove that barrier of disease and let them grow up to be who they can, that's making a difference, and that's why this is so important.